Study: People with disabilities perceive healthcare access as a human right. Researchers from the University of Kansas published their research about the perspectives of people with disabilities on healthcare policy. Participants overwhelmingly said that access to healthcare is important. They would also like policymakers to pay more attention to their needs. The researchers studied data from 35 phone interviews and survey responses from over 475 individuals with disabilities about health policy. The participants largely reflect the general American society's political opinions. However, they tended to agree that healthcare should be perceived as a human right. The participants would like to tell their feelings of social exclusion and stigma to officials to enact health policies in the U.S. Sarah Smith, the study's lead author, said that individuals with disabilities are marginalized and stigmatized. Smith, who is also a doctoral candidate in sociology, also said that policymakers do not listen to people with disabilities. The participants felt that access to health insurance was vital to help them participate in society. For them, policymakers do not take into account how the policies affect the lives of individuals with disabilities. 5 key themes about health policy perspectives among individuals with disabilities emerged from the study's interviews and surveys. Access to health insurance and health care is critical for the individual's ability to take part in society. The participants felt that political figures did not understand or prioritize the needs and experiences of individuals with disabilities. Participants presented various arguments about why policymakers and society should care about those with disabilities. People with disabilities who were in the study felt that access to health care is a human right or moral imperative. Respondents expressed largely positive views about the Affordable Care Act. For the participants, they cited the importance of employment in terms of access to health insurance, financial security, not relying on state programs for health coverage, and for personal dignity. The respondents argued that no one chooses to be disabled, anyone can become disabled, and better healthcare access will contribute to a more productive society. Since healthcare should be seen as a human right, it should not only be available to certain people. Sadly, they also experienced barriers to employment and political participation. The author said to expect new complications to access to healthcare to arise due to the U.S. aging population and long-term impacts of the pandemic. The researchers plan to address this in their future research.